So, so what happens after you form these antibodies? So what do they do to the baby system? We said if you have never been exposed, the first baby will be safe, but subsequent babies, full-blown antibodies. If you never got anti-D, then there'll be formation of antibodies. So what happens? So the maternal, these antibodies go and destroy the baby's red blood cells. Okay, so when they destroy the baby's red blood cells, it could cause so many things. One of the things it could cause is baby's anemia. Another thing it could cause is what we call icterus neonatal gravidarum. So the baby will have jaundice because of the destruction of red blood cells. So the products of this destruction will cause baby to become very yellow, and this could even destroy the baby's brain because of that bilirubin and you know, yeah. And then the other thing that can happen is what we call hydrops fetalis. So hydrops fetalis is whereby the baby's red blood cells have been destroyed so much such that the body is not able to supply, because red blood cells are the ones that carry oxygen, right? So the baby is not able to supply their vital organs like the liver and other systems. Okay, so if the liver is damaged, the liver will not be able to form proteins, so the baby will end up having a lot of accumulation of fluid in the body. The baby will end up having cardiac failure. Have it together, and the baby will be born like when the baby is very swollen, fluid everywhere, fluid in the tummy, fluid in the chest, and this baby's chances are that the baby might succumb at delivery or succumb even before delivery. Are we together? Are we together after that point? Okay, so how do you prevent all this mess? Because nobody chooses their blood group. You're born with your blood group. When you're born with your rhesus blood group, you know, if your blood group A positive, A negative, you're born that way. There's nothing you can do about it, right? So what happens is after your first delivery or in between the pregnancy, we will want to test your blood to see if you have these antibodies that will attack the baby. Okay, so if you get that you don't have these antibodies, then we will give you an injection to prevent any antibody formation in the mother's body. Okay, so that's what we call the anti-D injection. We'll give it at 6 months of pregnancy, that is at 28 weeks pregnancy, and then after delivery we'll do another test if you don't have antibodies, and if you confirm that the baby's blood group does not correspond to your blood group, then we'll do what? We'll give you the injection, anti-D injection. It's very costly because it's around 5,000 shillings. It's available in hospitals that have free maternity, but if out of stock, then you might need to buy from pharmacies and chemists outside. Okay, are we together? So how does this anti-D work? Story for another day. It's too complicated, it's scientific, but just know that it helps to wipe out any antibodies that you could have formed, okay, or prevent any further formation of antibodies, right? So when it comes to your next pregnancy, your body will be okay. You'll carry the baby and we'll give you an injection at again 6 months of pregnancy, and run tests at around 7 months of pregnancy, 7.5 months of pregnancy, and then give you after delivery, because delivery in itself is also one of the risk factors for escape of blood from the baby to the mother. Supposing you're that woman who didn't know about this and you have learned about it today, give birth to your babies, your blood group negative, their blood group positive, and you already have antibodies in your system. Like the first scenario, the first patient that I talked about. So what do we do about it? You know, is all hope gone? No. So would we give you that 5,000 injection? No, we wouldn't. Okay, so what happens is we just monitor you closely. Once you get pregnant, we measure your antibodies titers or the quantities in your system, and then we keep on checking for the danger signs in the baby. We keep on checking for signs of the baby having distracted red blood cells. Are we together? And then if the baby is severely anemic, there are hospitals that will transfuse the baby when the baby is inside the mother's tummy. Okay, and if need be, if you feel like the red blood cells are being destroyed more, the baby is being affected more, chances are that we'll deliver you much earlier, but with very close monitoring. Are we together? So if you're already iso-immunized, there's no going back. Nothing can be done about it, but there's hope for future pregnancies. Are we together? So we will monitor you closely. You come to the hospital, you come to the clinic, we know that you're already iso-immunized. We'll keep checking your titers frequently to see if they're rising or if they're constant. Then you also keep on checking the baby through ultrasound for any signs of the baby having anemia, the baby having red blood cells that have been destroyed. Are we together? And take action on the baby. If the baby is of good weight and the baby can survive outside, then we can deliver you much earlier. Okay, are we together? There's something else that I need to educate people on is if you are this blood group, then the doctors will know. We're all well trained on this. Like during delivery, we'll need to cut the baby's umbilical cord very fast to avoid any mixing of these two systems of blood, to avoid exposing you to the baby's blood more and more. Are we together? Yeah. So if you're iso-immunized, all hope is not lost. It's important that you know it, so that your obstetrician can follow you up, check your titers, possibly deliver you earlier. Okay. If in very big centers like our hospital where I work, or in Aga Khan, things like transfusion of the baby in utero inside the belly of the mother, you said the uterus can be done, and then you plan for delivery. Are we together? Yeah, so it's a very complicated topic. I try to simplify it as much as possible. I will not go into details about the dosages for the anti-D injection. I'll not go into those details. As much as you've understood how it's given, the rest leave it to your doctors. Are we together? So thank you very much. Subscribe, share this with as many friends as possible. Make sure you know your blood group, especially if you're a 14-year-old girl, 16-year-old girl. It's important to know your blood group. And if you're a girl, for example, you get pregnant when you're very young, and God forbid you get a miscarriage, it's important for you to get that injection, because you don't know in the future, once you get married and then you're already sensitized, iso-immunized, then it will affect your future pregnancies. Are we together? Right? So every girl from the age of 12, 14, because I think in Kenya the age of sexual debut has gone down significantly to like 10. So every girl above the age of 10 should know their blood group and their rhesus. So if you should know your blood group, I'm A positive, I'm A negative, I'm B positive, I'm B negative, and if you're rhesus negative, have this information in mind and remind your doctor, please. In case you get pregnant, in case you get an ectopic pregnancy, in case you get a miscarriage, please insist on the anti-D injection. So I hope this was clear. And yeah, one more thing that I forgot. I remember I had one patient she was rhesus negative, and she had come for her 9th delivery, 9th child. So I was wondering, this woman, how could she have carried all these pregnancies and she didn't know anything about anti-D, because she had given birth to all her children at home. So I was wondering, how is it possible? And then I called her husband, and then we checked his blood group, and voila, he was also rhesus negative. It's a very rare coincidence, very rare, because there are very few rhesus negative people in this world. So the husband was rhesus negative, so she didn't need to get the anti-Ds, because all her babies are rhesus negative. She didn't have that exposure. Okay, so it's also important for the men to know their blood groups. Drop any questions to @DijBusini on Facebook, or to benekakhadija@gmail.com, or call me if you have my number, WhatsApp me. Okay, thank you very much, and God bless, and Ramadan Kareem.